So every patient that has anything diagnosed, you're going to ask them a series of questions. Okay? So the first question is you're going to ask them, if possible, if the doctor's schedule allows, would you like to do that today? Every single one. Nobody, the person that's asking that question has no idea what the schedule looks like. They're not a schedule watcher. That's not their job. You don't want schedule watch. You don't want producers being schedule watchers because they don't produce as much, right? They don't serve as many people. All right, so that's the first question. You will be stunned at the number of people who will say yes to that question. You'll be stunned. The next question is, there may be a little bit of a wait. Is that okay? And you'll be stunned that everybody doesn't care if there's a little bit of wait. Now, there'll be some people that are on a tight timeline, and then once they find out there's going to be a little wait, I wasn't quite sure, but there's going to be a little, I probably should. But that won't happen very often, right? It'll be really rare. The next question that you ask in your practice has to be, do you have a particular doctor that would like to do that procedure, or would you like the first available? Now, this one hurts. this one hurts because our patients really love convenience, and particularly if it's something simple, most of them, 80% of them, will pick the first available, okay, which is great. All right, so then, and you guys use radios? All right, do you have a thing against radios? Is there a philosophical belief against radios?
No, just some of our staff have worked in practices before with them. And
Yep.
they complained about the constant chatter in their ear and that it was distracting when they
yep.
were trying to talk to their patient. And
Yep.
there's this.
Yep.
So we
Yep.
just haven't tried
Yep.
it.
So that is the lack of a system. Okay, so if there's chatter on it, it drives you crazy. So there's a system that you can develop on what gets said on the radios. Because a lot of times, if there's no system, people just say everything on the radio. They're not going to get up and go look. They're going to ask somebody, right? So the only certain things can be on the radio. Any transmission can be only 5 words or less. So you have to come up with a code on what things mean. And then when you're in conversation with the patient, it's okay to take it out. Other than that, it's got to be in. All right? And so what happens once you've asked those 3 questions and the patient is game, you get on the radio and you say, same day, op 3, composite. All right? And then people are listening to this and they figure out, they're looking at the schedule now and they're figuring out, can I do that? Can I do that? Oh, I can do that one. Mine's not going to be here for a while. I got a little extra time. Great. I'll take it. All right? Now, here's where it can go awry. There is going to be the wish to move the patient to a different room because we nest, right? This is my room. This is my room. That's Sally's room. This is Susie's room. This is my room. And if I'm going to take this, I want to do it in my room. You guys know what I'm talking about, right? And so we can't have that because now that takes another 5 minutes. Now you have the cost of taking down one room and setting up another. You can't do it. You got to do it where the patient is. So, and I know it's not always possible, but where it is possible, because of the design of the rooms in some offices, you really can't do that. But where you can, when you can, do it where the patient is, which means your rooms all have to be the same. All right? So when we figured this out, we went and we had to have all of the operative rooms the same. We had hygiene rooms that were configured for hygiene. All those had to be the same. And then we would still use those hygiene configured rooms. We just got a mobile cart that had all the restored stuff up so we could slide that in, plug it in, and we're ready to go. Had everything all set up on it, ready to go. Worked really slick. So don't move the patient if you can help it. But your team is not going to want to do that because they have nested where they are. And part of the nesting process is, I like my cotton rolls in this corner of the drawer, not on this corner of the drawer. right? So they all have to be the same, because isn't it frustrating when you go into a room and you don't know where anything is? It lowers their confidence in you when you're searching for stuff, right? Okay, so how do we get the team to do this? Sounds like more work.
You bonus them?
Yeah, bonus them. Absolutely. So this is an example of an activity bonus. Where they do an activity, they earn more, right? So the person who gets on the radio, and if you don't have radios, that means the person has to get up. It's less efficient. They'll like the radios when you fix out the bugs that you're talking about. They'll like the radios. But those are bugs. And everybody's going to complain about the earpiece and how it feels in their ear. That's right. Does anybody have put a radios in and not had that complaint? Yeah, they will. They'll complain about it. And they get used to it over time. It just feels different. But they have to find someone then. The person that gets up and finds somebody, they get a bonus. The person who takes it, the person they find, they get a bonus. So $5 for each.